Okay, great. Welcome to our TaroWorks webinar for June. Great, let's get started. My name is Elaine Chang. I'm the COO of TaroWorks, and we're really excited for today's webinar. As you may know, this Sunday, June 20th, is World Refugee Day, where we recognize the critical needs for inclusion for refugee populations. I was looking up some information on the UN site for this recognition day and read that 20 people leave their world behind every minute to escape war, persecution, or terror. So we wanted to use our TaroWorks webinar platform to recognize all of the organizations out there doing amazing work with refugees, making sure they're getting the same standards of treatment as anybody else, having things like the right to work, right to housing, education, assistance, getting access to courts, and a lot more. So if that's you listening to this, thank you for your work and dedication. Today, we're shining a spotlight on our client Refuge Point, which focuses on finding lasting solutions for refugees. On average, the time a person remains a refugee is estimated to be 20 years and counting. So Refuge Point's work focuses on refugees, helping them use their talents and skills to contribute to their host countries and to the global economy as a whole. So we're honored to be joined today by Paul Karanja, who's the Urban Program Coordinator for Refuge Point, and he's calling in from Kenya. Paul, welcome to the webinar.
Thank you so much, Elaine. Hello, everyone.
Great. Thanks so much for being here. And he'll be sharing much more about Refuge Point and his work in a minute. Before we get to that, I want to just say specifically for today, we wanted to explore the role of technology in helping the organizations that work with refugees. So a challenge that we hear often is that refugees may need many different services at different times, and some of them may need more assistance than others. But unfortunately, resources are limited, so we can't give all the services to everybody as we'd like to. So how can technology help organizations like Refuge Point target the refugees who are at the greatest risk and make sure they're getting the resources that they need for long-term success? So before we start the conversation with Paul, I'm just going to launch a poll to see where people are with this journey, and for those who are sort of thinking about getting a system, stay tuned till the end as Paul has some kind of advice and takeaways. So as you're filling that out, I want to go over some housekeeping rules. So everything is being recorded today, and you can actually find the recording afterwards on the TaroWorks.org blog site. We'll be posting it there and also on our YouTube channel. Also, everybody is on mute by default. So if you want to ask a question live, feel free to raise your hand. But I think for most people, there's also a Q&A section in the GoToWebinar platform. So if you see that, feel free to type your question in. I'll be moderating those and sharing questions with Paul at the end. Great, so still waiting on a couple responses. Okay, let me close it. Okay, it looks like 18% of participants today already have a system. 9% are in the process of evaluating systems. Some aren't using one but might benefit from one. 9% not familiar with case management, and 45% are here for another reason. Just jot that down. Okay, great. Okay, so thanks for that. At this point, Paul, I'd like to kick it off to you. I hope you're unmuted. And we'll have sort of a Q&A format for this. So I have some questions for Paul. So I think firstly, let's learn a bit about Refuge Point. So Paul, can you tell us about Refuge Point? What is your mission? Where do you work? Let's start with it with that.
Thank you. Thank you so much, Elaine. Yes, Refuge Point, we exist to advance the lasting solutions for at-risk refugees, and we also do support the humanitarian community to do the same, because one would appreciate that a collaborative venture is needed in addressing the issues of concern, and also when you look at the world's state of displacement at the moment. We speaking from Nairobi. The program I coordinate is based in Nairobi. It's a self-reliance program. And I think in this call, we'll be able to share a little more about our work and how we are also using technology to advance solutions for refugees. But we also have a collaboration project with the UNHCR. And through this, we are able to send experts to different locations, again, in the spirit of advancing solutions. Some of the experts would do more of resettlement work and looking for options for refugees in third countries. In another category, looking at elements of child protection and how to promote that also in different locations. So beyond the base here in Nairobi, where we are more focused on direct services, we also have that part of the program that devotes itself to advancing solutions and more so to third countries. We also do have the elements of field building. This is also a huge component for us. And in this, what we mean is that we are able to look at the lessons learned, because as we implement different programs, we are also documenting lessons learned. And then we are able to share this with others, so we can partner more closely with people who have either similar missions or gearing towards achieving similar goals. So we can support other organizations in this approach. But also there is also an element of systems change, promoting, looking at a more holistic picture, and maybe also looking at matters, policy at a higher level, and looking at where we can also influence change so that the protection space for refugees is enhanced, but also in regards to looking for different solutions and lasting solutions for refugees. Over to you, Elaine.
Great, thanks. This is great work. Just curious on this topic, what countries do you work in?
Okay, we are operating in several countries in Africa and also in Asia. Our headquarters are in Boston, US, but in terms of operations, several locations in Africa, Egypt, Malawi. I mean, they are really different locations, but also some in Asia.
Wow, great. It's a lot to coordinate. Okay, great. Thanks for that, Paul. So then we, in kind of understanding Refuge Point's work, there's a big component around self-reliance of refugee households. Can you explain what a journey to self-reliance means to Refuge Point and why that's important?
Thank you. Self-reliance involves really stabilizing families in the countries to which they have fled, and also helping them, regain the social and economic ability to meet their essential needs and reduce dependence on assistance. So in this regard, we are looking at, the family's ability to meet its needs over a period of time or sustainably. Very few of the world's refugees really are able to either return home or legally settle in the country of asylum, or resettle to a third country. And so these are really the durable solutions as envisaged by the refugee response system. And yet, only a very small percentage, less than 10%, are really able to access these solutions. That leaves majority of the refugees stuck in their countries and really dependent on support, from different organizations, from the systems therein. And so for us, this is how we come in. Promoting self-reliance for us means that we are supporting the families, even as these other solutions are explored in a way that families are able to really support themselves. Feed the family. If they are children, the children are able to access schooling. If there are medical issues, the family is able to attend to that. And so, in regards to what we are displaying there, it's actually a process. To take a family that has elements of vulnerability and low levels of capacity, to take them to a point where they will be able to stand on their own, that's really a process. And that's why we acknowledge each of those 4 components is starting with identification, because we've got to pick out which is that family that is falling through the cracks of humanitarian support. And after identification, you really got to assess. So we have to look at the different capacities existing in the household. And in that assessment, then we are able to gauge how then shall we engage with this family? What will be the entry point? Like what services will be needed? And that, of course, takes us to the process of stabilization. And this is a process we value so much, and we believe it plays a significant role in promoting self-reliance for refugees. So in this, you probably might have met a family where there is a member with serious levels of trauma, maybe a family that is just sharing a very small room in an urban setting, because the program I work for, we are supporting urban refugees who are based in Nairobi, Kenya. So you might find those families that do not have the essential needs. So you get in and then see what areas you're going to support. And after the family is stable, maybe they're able to, you can help them have food on the table, give them the very initial linkages like connections with the nearest primary schools or secondary schools. And then once the family is stabilized, then you can have more advanced conversations around empowerment, around livelihoods, around income generation. And then at that point, when families are supported, usually with business training and even business, providing them with grants, which they can use to run businesses or expand businesses if they already had small existing ones. Then through the income the families make, then they are able to supply the household needs without needing further assistance from organizations.
Great, that sounds really comprehensive. I'd be curious, how long does Refuge Point work with a household? It seems like it would be, over some time.
Yes, Elaine, yes, indeed. So the way we have set the program is that we support families or work with the families for a period of 24 months. It's a very nurtured work. All the services we are talking about, we got to assign somebody we refer to as a case manager, so that throughout the period of 24 months, the family has an immediate contact with Refuge Point. So we have noticed that some of the families might graduate out of the system a little earlier than others for different reasons. Maybe there is no health concern in the family. Maybe they are just able to move around in Nairobi freely. They don't have really serious protection concerns. And maybe they also have a good number of adults that can contribute to the household income. So when those factors are favoring the family, they may not take 24 months in the program. However, there are other families that take longer than that period. Maybe there are just serious complexities in the household. We have households which are headed by minors. So we don't exit child-headed households until the primary the lead child or the head is above 18 and has been supported and connected to other livelihood ventures. We also have families maybe where there is a mental health condition, and maybe it's a family size 1. If somebody has mental health issues and they are in the system, then it becomes also a bit hard to exit them from the system. We tend to keep them a little longer on services.
Wow, great. Yeah, sounds like there's some shorter than 24, some over, but on average 24 months. That's a long time to be working with a household and providing all these different services. Can you explain what the operations look like for Refuge Point? It seems like a lot of people need to coordinate with each other. So who's doing what and how are they coordinating with each other to provide these services over on average 24 months?
Yes, thank you, Elaine. Yes, indeed, having adopted a holistic approach, it means there are several areas that come into play. Some of them are come into play at the very early stages of identification. Some will come a little later. But if I was just to talk about outreach and also the process through which we are able to identify needy and families that have low capacities for self-reliance, we use mainly an outreach model where we have a group of staff. We call them community navigators, and these are refugees. They stay together with in the same locations as their fellow refugees, will have the benefit of speaking the local languages and all that. So they are very pivotal in our identification process. And once they identify needy families, they front to the system, and then the system is activated to carry out the necessary assessments. At the moment, there is a tool we use called the self-reliance measurement tool. But you might have heard, probably a good number of participants today might have heard about the self-reliance index. And so these are tools that we are using concurrently, and they're able to help us know the levels of self-reliance for a household. So the ones that score low at the moment in our scaling at less than 2.7 out of a possible 4. Those families are considered the most needy. And so the system is activated in terms of responding. So the initial responses there would be coming from the social work unit, and that means the family. We collect biodata, get information about the family, create rapport with that family, and then we are able to understand them better, get to a more in-depth assessment, just trying to understand their situations and their scenarios they are living in. And at that point, also the case manager, who is a social worker, develops a case plan with the family. In that case plan, they will outline, the role of the family. How does the family come in their journey to self-reliance, and how will they be supported by Refuge Point? At that point, you start getting now connections at that social work point, because some of the referrals for the families would be for food support, for rent support. If there are mental health issues, then there will be referrals to the counseling unit. Some of the family members could be dealing with a health issue. So again, lots of referrals across the system. I would say actually at the point where a case is assigned a case manager, then you start seeing lots of connections. A family might have a child who needs to access schooling. So in our child protection interventions there, we would certainly link that family to the nearest primary school. And then from there, we see how to support them with the payment of levies. And then the children are able to pursue learning. We consider it as a great benefit when children are in school, because that allows the primary caregiver to devote their time to income generation. So once children are settled, it is possible to do a referral to the livelihoods unit, and then they take on that case. They will enhance their business skills, and then they will also grant them. That means the caregiver is now able from that point to start generating income as the children attend school. So there are really lots of connections, and I want to believe we will see also a little later in the presentation.
Great, that really does seem very holistic, both in terms of the services that you provide and also, it's helping the entire family, not just maybe like the head of household, for example. So this is great. Thanks, Paul. Okay, so I wanted to kind of shift gears and talk about then how technology is helping with all of this and how it's helping you achieve this. So I wanted to kind of start at the beginning. So before you started using your current system, how was Refuge Point managing all of this coordination and data? And why did you decide that you needed an improved system?
Right, thank you. It was pretty tough for us because, first of all, the way we stored the data, that system did not allow lots of manipulation and functionalities like we enjoy today. Much of our records, client records, were stored on Microsoft Access, and one needed to have logged into the database, and I would say also the server, to be able to access that information. That means you would have to collect information out there, maybe using paper, pen and paper. Then you would have to devote some time, you sit at your computer, and then start keying in that information. And of course, if there were any eventualities within, either with the internet and something happens to the server, then you, more often than not, you would actually lose that information. Then we also had a challenge of having data stored in multiple locations. Some of the data was, yes, much of it I would say was in Access, but then there were some sections of staff who are just using Excel sheets and workbooks, either to keep records of attendance in workshops and all that. And so lots of information just being kept on people's computers. So it meant that if you needed some information, you'd have to really walk around until you get it. And that was really a process. Then we also had the challenge of increasing data needs, simply because the population is dynamic. You always have new arrivals, and more dynamics. You need to capture more information, more parameters of what you have covered before, and then there may be more increased data demands. So that kept on rising up, and the system couldn't really handle as we had hoped. Of course, the whole issue of slow responsiveness from identification to the delivery of services, that was a serious challenge, because if a client was identified, it meant that the person who is really advocating for the client to receive services, you then have to walk to the next person and present the case, and then somebody has to listen to to your story, and maybe a little documentation is done, and then maybe there will be a message that we need to send somebody to do a better assessment, and then the assessment results are received, a little bit of thinking there. So the system was not as responsive to the client needs. So that was actually one of our main disadvantages, and that is what also created a thirst for a system that would give us more flexibility. The fact that one needed to be at a certain location to access data, that was extremely limiting, because you would get a call, you are in one location of Nairobi, and you have a call from a client, and you need to check the information that is already documented about this client, so that you know how to respond to them. But then that was not possible. You would have to tell the client, wait a little bit, maybe I'll give you a call tomorrow. But it's really not the case with our system today. And so because we appreciated that we had lots of limitations, I think this is really how our thirst for a new system was created.
Yeah, we hear that a lot, and especially with, I guess, the population that you work with, you really need to be able to provide services quickly. So that makes a lot of sense. Okay, just so the audience knows, Refuge Point actually worked with our close Salesforce implementation partner, Vera Solutions, to design and build a new case management and impact tracking system. So, Paul, can you share what was the process that you and Vera Solutions went through to design the solution and choose the functionality that you needed?
Thank you. And I actually must say that Vera Solutions has been very supportive throughout our process. We felt like they came in to understand our pain points and then work with us to be able to move from the current state to a more desired state. So I remember in our earlier days, the interactions were around, a discovery workshop. We had a workshop. We had Vera team coming over to Nairobi. I remember one of the things I remember is that they had many questions. And I think that is why it will be referred to as a discovery workshop. They wanted us to describe to them the processes we take, from the very first point to the last, from entry to exit. So we did lots of descriptions. There were lots of meetings with the different departments, because you can imagine the person who knows where it pains most is the immediate user of the information. So that workshop was very helpful. It also helped us to really understand what we needed, because if these were the gaps, we were always given that chance of saying, where do you want to see change? Where do you want to go? So that is one of the things we fully appreciate in terms of the process they took us through. Then with that information, they were able to go back and start developing a system, and I would say here a system for trial. So they did their maps from all the information they received. They used that information to design a system, and in that system, I would maybe even at this point talk about Salesforce and TaroWorks. In that system, they were able to present it in a way that we would try things out, right? And were given some time so that we could practice the new features and the new database system. And so we would try it out and then also give feedback. And that was very helpful. So it was this feedback was on two ways. One, because the TaroWorks is quite connected to Salesforce, so part of the feedback had to do with how are the two systems working together. And so as we, and even before the actual trying out, there was a staff training where again a team came from Vera to Nairobi, and they took us through the system. That training was very important, because if we were to really start trying out things, probably it'd just be a mess. But I appreciate that we had a time devoted and we were trained on the system. And then, being shown and navigating through, these are the new features. This is if you want to get this kind of report, this is where you will go. If you want to put this information, maybe it's a case note, or you want to make a referral from one department to another, this is where you go, and all that. Then after that training is now when we got some time to be able to practice. And of course, with the practice, lots of sharing of feedback with Vera Solutions, and then they were also able to tweak the system so that it was as responsive as possible to our needs. So as I said, I think I really appreciate the support that we have received all along from Vera Solutions, because it starts all the way from just understanding your pain points and also working with you more or less step by step to a place where you would say it is more desired.
Great, thanks, Paul. And actually, that photo is from one of the sessions with Vera Solutions. Is that right? Let me actually just go back to that slide.
Oh yes, yes. Without naming names, I think I can't remember these characters. Yes, this was one of the sessions of getting deeper. Yes.
Yeah. Great. Okay, I'm actually going to switch over again to talking about the benefits of this system. Paul, you kind of mentioned that what you ended up with after Vera Solutions design and build is a system based in Salesforce with TaroWorks for the mobile users. So let me go into the benefits then. So how is Refuge Point using the system now?
All right. Thank you. I think I didn't mention the interconnectivity between Salesforce and TaroWorks. You can sync, and once you sync the information from TaroWorks, it is received at Salesforce, and so that gives us unlimited possibilities. One of the ways we use this is you carry out an assessment on TaroWorks using the self-reliance measurement tool. So you have that information, and once the person going out is done with the assessment, all they need is to sync the gadget, usually mobile phones or even tablets. Once that happens, on syncing, the information is received on Salesforce. That means the next person who should see the way the family scored, as I said, anyone scoring below 2.7 out of a possible 4, then they are considered as a core client. They are taken into the system. They are assigned a case manager. So you can see how we use this at the very early stages of case management. So once you receive these scores in the system, you basically get a prompt. There are 2 or 3 of us who get prompts, and that allows us to assign a case manager for all cases that are considered low in their score on self-reliance. I mentioned about also the self-reliance index, and so we are actually at a point where we also are hoping to integrate this into the system. The self-reliance measurement tool is an older one. It's also a great tool, but I think we are moving on to the self-reliance index, which, unlike self-reliance measurement tool, is really not developed in-house. The self-reliance index was also developed in collaboration with other actors in the field, and there were a lot of conversations around this because other organizations also needed to have a system of measuring self-reliance. So we came together, and as a result, a tool we call the self-reliance index was developed. It is, I think, in over 4 languages at the moment, including English, Kiswahili, Arabic, yes, I think, and French also. So it can also be used in multiple locations. We do hope to have this tool integrated in Salesforce and TaroWorks so that we can move now from self-reliance measurement tool to the self-reliance index. So between the two, our case management is really promoted because of that connection as well. Because if you do assessments and you're doing them on TaroWorks, then you sync your gadgets, that the assessment results, whether it's a business monitoring visit, whether it is a business assessment, whether it is an assessment to determine whether somebody qualifies for services or not, that information is received, and it allows the next person to know who to pick and how to proceed from there. So in this case management, it also means that you're able to do referrals and you don't do them outside the system. If you want to click a referral, say to counseling, all you need to do is to go into the system, and then you make that referral in the system. It is also received in the system. It is also acted upon in the system. And whatever documentation that is needed, again, it is within the system. So the staff members do have lots of flexibility because there are case notes you can make out there while you're in the field, just using your mobile phone. And then once you sync, they will be received. The other person might be seated in the office. They are on the Salesforce platform. They will be able to see that information. and possibly start acting on it. Of course, the other use I need to highlight is reporting, because this system has really allowed us to generate multiple reports. You can have a report on a specific household and look at the progression. Like for instance, you might be interested to look at how have they been improving on their self-reliance score. So you can look at that over time, because that the assessments with self-reliance measurement tool is done every 6 months. So within a period of 24-month engagement with a household, you can actually see the trend. But beyond that, there are several other reports, like, work could be pending at a certain unit. Maybe you have done several referrals to the counseling unit, and you just want to follow up on what is happening. At the management level, we are also able to see the load that is carried by, say, social workers, the counselors, because all I need is to go to the system and see how many cases have been assigned to this person. And I can tell if we have any space for new clients or not. Or even if we have space for new clients, then they would be assigned to case manager X and not case manager Y, because from the system I can see the caseload per case manager. Those are some of the areas we have really explored and seeing the benefits of using the system.
That's great. It sounds really robust. Let's see some of these in action. So can you share kind of what have been the most helpful parts of the system in your role as urban program coordinator?
Yes, I think the fact that the system, it's a holistic approach. You can appreciate that there are different parts that play and come into collaboration with each other. So I think for me, the Salesforce linkage is really one of the main benefits for helping me to coordinate the work and just maintaining that bigger picture when you're thinking the different components, because under each of these, there is a lot that happens. I might just display something here like health, but under health, we are looking at different components, the supporting clients with prescription medicine, supporting some of them to access secondary health care, and also making referrals for specific investigations. So there's a lot that happens per each of these units. So one of the benefits of having this system is that you're able to see what is happening between units. You can also appreciate the interplay and coordination from one unit to another. And maybe where there should be a higher level of collaboration, which you may not be seeing, then you are able also to activate it, collaboration between one unit to another. If I look at some of the diverse reports that I'm able to generate from the system, including which referrals have been made, but they have not been acted upon, then that's a very important coordination tool, because all I need is just to reach out to the next person. In any case, even that other person who should be acting on those kind of referrals, they are also open to look at all the reports in the system. So there's a way you got to keep on interacting. And in these interactions, I want to believe to a great extent, it contributes a lot to coordinating, a whole program.
Great. We all always say that Salesforce should always be kind of that single source of truth. So it sounds like that's you're getting to that, which is great. Okay, and then another one of the uses you mentioned earlier was case management. So can you give an example of how the system's used for case management?
Yes, and indeed, as you said, yes, we also consider this as a real single source of truth. In terms of case management, if I would give like an example of a client that has been identified out there in one of the locations by a community navigator, or even a referral that has been received from another organization, and they write to Refuge Point seeking support for this client. Or maybe the person walked over to the office. We have walk-in clients, people who hear there is an office here called Refuge Point, and they support refugees and asylum seekers. So they would basically walk in. Or we have worked with a refugee family, and they also know of another refugee family in the neighborhood, and they front their case to the case manager and say, hey, there's another family out there in very similar circumstances. Could you see how to help them? So regardless of how the case is identified, from our case management approach, it means that the next the next step that is activated is a more comprehensive assessment. At all these referral points, there is a brief assessment that is conducted, which points out to the needs and why the person is making the referral. Because even if you have received from an agency, there is a reason for referral. But now for us to look at it more keenly, we got to carry out an in-depth assessment. And I think that the current tool we are using at the moment is a self-reliance measurement tool. And now with this, you get to understand how the family is faring. You will appreciate that the ones that maybe are highly vulnerable will also have a low level of self-reliance. That also means their score will be minimal. Immediately, the person assessing this case thinks their gadget, I would receive, the results together with the head of social work and child protection, and either of us will assign that case to a case manager. The case manager then would go a little deeper with the family. They will seek to understand the family composition and the other dynamics that come into play within the family. They also gather information about their flight history and really the current situation the family is living in. All this information helps the case manager to be able to design together with the family a case plan. And in a nutshell, we say a case plan is a roadmap, pointing to where the family would want to be. So it's a very collaborative venture between the case manager and the family. Some of them will talk about, they want to be able to provide for their families. They want their children to get an education, and so many other desires the family would have. A principal point, of course, is what are the existing capacities? What is it that the family holds at the moment that they can use, in their journey for self-reliance? So once all these considerations are made, and the capacities here, I mean, maybe there is a family member who has done business before, there is probably somebody with a vocational skill, or maybe other things that would act as an advantage to the family. Then the case manager, being the primary point of contact between the household and Refuge Point, will again get into the system, consider the scores that the family got during the SRMT assessment, and with this, then they are able to decide what services would be most appropriate for this family. Of course, they also consider the requests of the household. And as we said, also different households would be different depending on the issues the family is dealing with at that point. So there are lots of triggers really at that point, because connections will be done, and referrals and connections will be done from the case manager to either the livelihoods team, to a health staff member, to a social worker, to the education person, to the child protection person. So lots of collaboration there would be required. So while all these supports would be provided to the family by the other team members, the case manager remains the primary contact. So if the family feels maybe they are ready for business support, they would highlight that information to the case manager. If the family feels they need this kind of support, they would certainly link that with the case manager. So we prefer maintaining one point of contact, and while the system becomes the one source of truth. And since everyone receives referrals within the system and also documents the progress they are making within the system, That means any staff member can actually see the most current status of the case. And we believe that this is a great thing in terms of looking at case management in broad and also more holistically.
Great. It sounds like you're really able to kind of tailor services to the household system. Great. And then I'd like to just quickly go over some examples of dashboards. So it sounds like you're collecting a lot of information about how you're working with these households. What kinds of things are you tracking?
All right. So some of the dashboards are really high level dashboards. Like from the Salesforce system, I can be able to tell the current number of active cases or core clients. In terms of the budget, we work with a certain number, so I can always track and see how far are we, how are we faring. I can also look at, from those broad dashboards, I can look at the number of clients by nationality. I can work around different functionalities there. I can look at the demographics. So for instance, there are times you might see that there is a certain nationality, we have more clients from a certain nationality. And what this activates is that we then also need to maybe open our ears more and listen to other stories and cases from different nationalities. So sometimes you also, you look at the demographics, you will see the number of children and all that. And maybe there is a call, not just by refugee serving organizations, there could be a call by other NGOs, not just serving refugees, and maybe openings for scholarships and such like things. So we really want to see how the entire caseload is moving across different and broad parameters. But you also can have dashboards that show you a certain cohort, a certain group, how a certain group is faring. For instance, maybe 2 or so years ago, we started working with locals. Initially, we were basically supporting refugees, but since that time, we've been supporting around 10% Kenyans in the program. And I can have a dashboard just looking at the entry point and the period of time, like the locals take to move from a point of need to a point where they can really stand on their own. And it's some of these things you can use to make comparisons. There are also other dashboards you can consider for just household-based. You want to look at the different things that are happening within a household. Maybe some of these things would have to do with the family got a business grant of X amount during this time. They invested in this kind of business, and then over time, they're able to generate X amount of money. From this, you can also compare, what businesses may be more productive, more profitable than others. You can also compare data by location. Are there benefits of people staying in a specific location? So you can really look at all that. Those are some of the dashboards, but maybe also let me just start something on livelihoods, like when a referral is done for livelihood support, and usually this is done when the family has already been stabilized, the social worker has really worked with the family, and they feel they are at a point when they are ready for business support. At that point, the case manager would do a referral, and I would see those referrals in the system. So what the livelihood program manager does is then to assign these referrals to the different livelihood staff members, and then from there that triggers an assessment. So it is a tool that allows you to see what referrals have been made, even when were they made. What are the reasons behind these referrals? What are the factors that are working towards receiving these referrals, and where is our point of hope? Is there a hope that if we take it up, then we will see some results at some point? So all this information, since the system Salesforce TaroWorks, you can do lots of reports. You can generate lots of reports. So this can communicate to the managers, to the middle level managers, and any other person who is doing coordination work.
Great, thanks, Paul. I just want to do a quick time check. We're almost at time, so if you have any questions, please send them in. Paul, I might ask some questions out of order here, but we had a question from an audience member about the response to COVID-19. So maybe I can skip to that one. Yeah, so we've seen that COVID-19 has halted or at least drastically changed the way organizations, especially those that do community work, have been working. So we've also seen a lot of our clients come up with kind of ingenious workarounds and different ways of using technology to continue working with their beneficiaries during this time. So can you go over what Refuge Point has done to continue working with the refugee population during or despite these COVID-19 obstacles?
Thank you, Elaine, for that question. Yes, we have moved to supporting clients mainly through digital platforms. Most of our services now can be delivered using those digital connections, and of course, premised on the fact that Salesforce and TaroWorks, they are cloud-based. You can work from anywhere. That is already one benefit. So we are doing lots of telephone contacts with clients. So if it is matters counseling, there is telecounseling, either for individual therapy or for group therapy. The case managers often contacting clients on phone, gathering lots of updates on how the family is faring, and also being able to put that data in. We actually at the moment where most of the team, we are working remotely. And so these contacts have not been stopped because of COVID-19. If it is the health team, lots of telemedicine is happening, especially cost made to patients with chronic health conditions. If you consider business skills training, again, that is being done digitally, so especially through Zoom. And also we have a good number of clients who are marketing their products through WhatsApp and all that. And if we also need to communicate something, we also have the bulk SMS system. And through this, we are able to communicate messages to refugees. So I would say, Elaine, a lot is happening just by the use of technology. We are still able to maintain contact with our clients.
Great, thanks, Paul, and hope that answers your question, Ayusa. I think I might just go back here and talk a little about, we've heard a lot about how the system is helping like the case managers and folks like you, Paul, in your day-to-day. I'd love to talk about what the benefit to the actual refugees are from you guys using the technology. So how do you think the refugee communities that you work with have benefited from you using Salesforce and TaroWorks?
I believe the principal benefit is timeliness of response, because the system has really now improved our response time. The fact that you can get a prompt as soon as that prompt is made, and that prompt also triggers a reaction, it means from the process of identification to providing the stabilization services to the point of empowerment, lots of time is saved on that. If you consider that maybe some of those case plans before were being done through pen and paper, and now all you need is to swipe through a form that is already engraved on TaroWorks, and you're just using a mobile phone, that means even the assessment time has actually really improved. So for most connections, I would say actually the time has been reduced by even up to 50% or more. And so that means refugees are able to get more timely services. I would also want to say maybe in terms of a more coordinated response, that is also one key benefit. You cannot overlook the prompts and the system and how each part communicates to another. So even if you really didn't want to speak to another person, you would certainly be made to speak and reach out to them because they have a part they are playing in the system in promoting self-reliance for refugees.
Great, that's wonderful. Okay, if you have any last questions, please send them in. Paul, I think I'd like to end now with just getting some insights and advice. You've been in this role and you've worked with this system for a while now. You've also seen what it was like before. So I'd be curious to know what kind of, well, I guess almost half of today's participants that they were also somehow using or evaluating case management systems. So what advice do you have for them? And if you could redo the process of rolling out the system, is there anything you do differently? Yeah, would love to get your insights and advice here.
Thank you. I would actually want to really welcome participants who may not have tried these kind of systems to explore and get into these new grounds. I think there are more benefits than maybe holding on maybe previous systems. I would say that, you know, just looking back and appreciating some of the steps we did, those are things I could recommend or highlight as very useful. The whole issue of really knowing where do I want to go, and where am I now? Those discovery sessions were really, really helpful, and anyone considering this kind of system, I would encourage that they actually consider that. Then, of course, the whole issue of even when people are really pushing towards either specific goals, specific targets, that deliberate effort to allow enough time for the users to try out the new functionalities and also provide feedback. I think Vera Solutions or any other consultant, can really not design a program if they do not get the benefit of the full information, like what are the pain points, what are the deficits, and really where do you want to go. But if maybe for some of the participants, they probably also need to consider elements of data transition, because it seems if you're already using one system, like I said, we are in Microsoft Access, you need to consider that element of transitioning that data from your current system to a different one. And that was a process, and actually it took a bit of time there. But also staff training and capacity building. And especially if maybe you have a team that has not used mobile data collection tools before, you really want to take time with them to help them understand. But I think I would say above all, just be willing to explore new possibilities. There is a lot these platforms can offer. I think one just needs to be willing to explore new possibilities. We are there. I would say we are there. My email should be presented at some point. Vera Solutions will be there. And, you know, other actors who are already in the space, I want to believe we can chip in a word or two anytime maybe we get a response from an interested user.
Great. Thank you so much, Paul. This has been super interesting. Thanks for all of the details and the color about everything you're doing, both in your kind of day-to-day and how you're using technology. I think it's really inspiring to see, yeah, all the benefits that you've been able to do. So we're super proud at TaroWorks to be part of this journey with you. And yeah, I think, yeah, just keep up the great work. And thank you so much. Thanks to everybody who joined. You have Paul's email here if you do want to reach out, and also for TaroWorks. Yeah, I think look out for the recording on our YouTube channel, and I think we'll end it there. Paul, thank you so much for your time.
Thank you. Thank you so much, Elaine, for having me. And thank you so much to the participants.
Great. Have a great day, everybody.
Thank you. You too.